is Jane Barratt, and I'm the Secretary General of the International Federation on Aging. This 360 It is a spin-off conversation from the AiArthritis Voices 360 talk show entitled Biosimilars, What Patients Need to Know. There were great discussions related to biosimilars safety, efficacy, switching, substitution, interchangeability, and regulations in the main episode. However, the dialogue does not and should not end there. Building upon it, the focus of this segment is to shed some light on the impact of mandatory biosimilars policies on patients' continuity of care and elements for consideration in upcoming ophthalmic biosimilars policies. We're going to touch on three topics very briefly. The first is the impact of mandatory non-medical switching biosimilars policies on patients' continuity of care. There is an increasing concern from patient and advocacy organisations like the IFA regarding the basis for the mandatory non-medical switching biosimilars policies and the impact that that could have on current and future patients. This is particularly important because we have seen the impact of policies that favour cost savings over patient care. It has a cascading effect that is often detrimental to the health and well-being of the patient. Loss of vision, for example, is linked to loneliness, social isolation, feelings of worry, anxiety, and often fear. While biosimilars provides greater options for the patient, non-medical mandatory switching of ophthalmic medications may in fact negatively impact patients whose vision is stable on the original medicine. Our call to action is in agreement with the Canadian Ophthalmological Society, where we caution against mandatory automatic shifts from the originator biologic to biosimilars until there is sufficient evidence that has been collected to maintain patient and physician confidence. The second topic relates to the crucial need for patient education on biosimilars. Being informed about new treatments and policies and how they will impact care is crucial for patients to access appropriate, safe, and effective treatments. This is important because the development and implementation of biosimilars has implications for the management of patient care and access to treatments. Evidence-based information and education remains a key gap and an area that we must respond to. It is essential for patients to be knowledgeable, to be informed, and to be part of the discussion with the physician to ensure the best possible, safe, appropriate treatment for their particular condition. Our call for action is that there is a need for adequate education and awareness amongst patients to ensure they are well informed and to build the capacity and capability of patients and the organisations that represent them to be actively involved in the development and management of care policy. Our third topic is about the importance of patient-physician consultation and choice of treatment. Dialogue between patients and physicians is the only way to informed decision-making about kind of treatment and management for the physician in the long term. Why is this so important? Clinical dialogue in conjunction with comprehensive patient education are just foundational elements of a good vision health plan and policy framework. And that's what's critical in the development of biosimilars policies in ophthalmology. Patient choice in consultation with the treating physician, alongside the principles of safe, effective, and appropriate management and treatment, must be the norm, not the exception. We call on all governments, patient and advocacy organisations, and those that work with and represent patients and their families to ensure that we respect and protect their rights to non-restrictive treatment choice in consultation with their physician. In closing, the International Federation on Aging, which is based in Canada, supports initiatives alongside many national and local organisations to improve, restore, and maintain the vision for people around the world. However, many Canadians must start preparing for potential policy changes that impact the eye treatment that they are having at the present time. We must protect the right for patients and physicians to work in consultation to ensure the most appropriate, safe, and effective treatment. We call on policymakers in the development of future policies that impact the treatment of eye conditions to be evidence-based and enable informed decision-making. Thank you very much.